Hey everybody, it's Kevin Henry, Editor-in-Chief for DrBicuspid.com, and welcome into another edition of the DrBicuspid.com podcast. As promised, we're doing a series with Bent Erickson and Alan Twigg on a lot of things that are HR related, and I'm really excited about that and excited to welcome back in my friend Alan. Hey Alan, how are you, man?
Hey Kevin, I am doing great. Thanks again for kicking this thing off. It's fun.
Well, thank you for working with us on this because I think there are so many things going on in dental practices right now that people don't truly understand the legal ramifications of it. And I'm so thankful you're taking time out of your busy schedule to help explain a few things here.
Yep, absolutely. Happy to help.
So let's talk about travel and let's talk about continuing education events, because I know that this is a very hot topic and it's one that I'm sure you get bombarded about. Can you walk us through a recent case which revolved around CE travel and what it meant for the team members and the doctor?
Yeah, definitely. So this was another unfortunate one. This was a practice where the doctor always took her team to a CE training that was nearby in their area. And so it was a regional CE event. It was one that did involve a little bit of travel and then staying overnight in the hotel and doing the course on the weekend. And the doctor would always encourage the team to go because it was kind of a team building thing. She would pay for some of the travel costs and again, encourage the team to go. Some of the employees would get CE, credit for their time in the course. But the doctor would not pay for any of their wages while they were in the courses because the doctor figured, well, I'm paying for some of the travel costs and this is kind of a free trip and free CE. And so she just never felt like it was necessary to pay the wages. She ended up hiring a new employee, and the new employee, the next time this CE event came around, the employee went with the team to this training. And then a few months later, the employee left the practice. And a little while after that, the doctor received a wage and hour claim from the state labor board. Good. And the state labor board then did basically an audit of the wage and hour rules or the wage and hour practices in this office. And unfortunately, it did result in a wage and hour penalty, and not only on this one employee who had gone to the training, but it was a penalty that impacted all of the practice's current and former employees, and it went back 3 years.
Wow.
And that is unfortunately pretty common with wage and hour investigations from the states. They typically do go back 3 years, and it's not limited to just the employee that complained. It is on all current and former employees. And then there's typically some penalties on top of whatever the back wages or back overtime or whatever are owed in this case. So this was a pretty expensive one for sure.
So I guess the question, can doctors make it mandatory for their team members to attend CE? And is that a legal implication to know about?
Yeah, so this is a great topic. And I mean, you and I could easily sit here for 3 hours talking about CE because there are so many different, types and scenarios. There's lunch and learns, there's, day events where you don't stay overnight. Then there's travel ones, there's airfare, there's, what if they're getting CE credit? What if they're not?
Sure.
Are they doing productive work on a patient during a course? There's so many different variables. But the biggest thing that employers need to know about CE is that it is not like vacation or holidays or these other benefits where you as the owner get to decide everything about what you pay for and who's eligible and all of that. See, with something like holiday pay, there's basically no state or federal rules that dictate which holidays and who's eligible and how many hours. You get to decide all of that. But CE is not that way. So with CE, there are federal wage and hour rules. And if you're in California or Washington, there are some additional state provisions in those two states. So if people are curious and they want to look this up, they can write down this number. It's 785.27. And that is a federal labor code. And it's, again, Federal Labor Code 785.27. Because sometimes we tell people about this and there's so many sort of old wives' tales and misconceptions that circulate in the dental world that sometimes people don't even believe us that this is real. They think we're making this up. But you can Google it and you can find that federal labor code. So the first thing to know is that the federal government, and it's the same for California and Washington with their state rules, the government has 4 criteria that they use to determine whether you are, in a sense, in the game with all these CE things. And if you're in the game, then you have to pay for wages while the person is in the course, and you have to pay for certain travel, and there are some other details with it. So these 4 criteria are really important for everyone to know what the 4 criteria are. Now, you mentioned earlier this idea of can they make it mandatory? So that is one of the 4 criteria, and this idea of is the employer saying that you have to attend this or is it voluntary? Now, there's a big asterisk, and this is even in that federal labor code. There's a big asterisk at the end of that one, which is that it's not enough to literally just use the word optional or required. It's all about how the employee might feel about this. So, for example, let's say that the employee kind of gets the sense that if they don't attend this course, they will be seen as not a team player, or they may not get a raise, or they're going to be left out because everybody else is going, or it really seems like the doctor, wants them to go. In that case, the government does not determine this to be actually voluntary or actually optional. So again, it's real important that, you can't just say, well, I didn't say it was mandatory. I just said it would be a great idea for them to go. Well, that basically tips the scales in the eyes of the government. The second criteria is whether this is during regular working hours. So let's say the practice is normally open Monday through Thursday from 8 to 5, and we want to close the practice on a Thursday, and everyone's going to go to a course on that Thursday between 8 and 5. Right away, just that one criteria all by itself, that triggers it, and now we're in the game. So even if it's optional, even if the other criteria, just the fact that it's during our normal practice working hours, that trips one of the criteria, and now we're in the game. And this is not one of those things where, if you trip 2 of the criteria and you don't trip the other 2, then you're not in the game, or, all you have to do is trip one of these criteria and you're in the game. Okay. So if they make it mandatory or they imply that it's really mandatory, that trips it. If it's during regular working hours, that trips it. The third one is whether this is directly related to the employee's job. And that one is really tricky because why would we send someone to a CE training if it's completely unrelated to what they do in our practice?
Sure.
Now, there is a little caveat with that one, which says that if the employee is getting CE credit for taking this course, that criteria is actually, in a sense, null and void. So if someone is a hygienist and they're taking this course and it's for maintaining their hygiene license, then the fact that the course is obviously related to hygiene, that criteria is not tripped at that point. But let's say we're sending someone to a course and it's to expand their functions, or maybe it's to learn a new technology that they don't currently learn or they don't know, and it's going to improve their current job. That triggers that criteria. The fourth criteria doesn't come up very often, and that's where the employee is doing productive work, where the practice is actually making money from the labor that is done in the course. And at that point, it's basically work, and that triggers one of the criteria, but that one's not as common. So those are the 4 criteria, and those 4 criteria, like I said, kind of put you in the game. And when you're in the game, then we're talking about wages and travel time and potentially expenses and all of that. But I know I just threw a whole bunch of stuff at everyone, but that's part of that labor code 785.27 is just these 4 criteria, and a lot of folks just aren't aware of it.
Well, and it's important to know because as the case is talking about, the dentist is often thinking he or she's doing the right thing for the team and taking them somewhere nice, all these different things, but all the ramifications that may be unknown are so important to know. And also, dare I say, be communicated as well to those team members too.
Right. Absolutely. And to be very clear, we are not anti-CE. CE is fabulous. It's wonderful. It's incredibly beneficial. I mean, there's obviously good CE and bad CE and all of that, but it is absolutely recommended. So I don't want anyone to come away from this thinking, well, if I have to pay for it, then by golly, I'm never going to do it ever again. Don't go down that negative path. I know some people say, well, what if I take them to a CE and I pay for it and then they quit? Well, what if you don't take them to a CE course and they stay? So there's still tremendous value. What I always recommend is learn these rules and these provisions, understand how it all works, and then just treat it like a budget line item. You've got your budget line item for insurance and marketing and everything else, and just have a budget line item for CE. And once you understand these rules and what you have to pay for and what you don't, well, then it's just a matter of almost like a team discussion and saying, okay, here's how much we have for the year. And we can either do a bunch of small events locally, or we can maybe do one big one. And maybe it's, you alternate from year to year how you do it. But just have a budget and then be compliant within that budget. And it's pretty straightforward.
Well, I know the folks at Ben Erickson help keep it straightforward, which is an amazing thing right there. So, Alan, tell people how they can learn more and maybe reach out to get more resources.
Sure, yeah. You can go to our website. It's just benterickson.com. And there's some good info in there about something called our HR Director Package. And that HR Director Package is our main thing that we do with clients. It's all about compliance and also having the resources to manage your employees. And there's a whole bunch of parts and pieces to it in terms of HR materials, ongoing updates, and also advice from our HR specialists. And they're available via phone and email. So for questions like, we get this one all the time where someone calls in and says, okay, I'm taking my team to this CE event. It's coming up in a few months. These are the parameters. What do I have to pay for? What do I not have to pay for? And then we can walk you through that. So yeah, it's all included in there. And that HR Director Package is just a really great foundational thing that I think every practice can benefit from.
Well, Alan, I really appreciate the time and expertise today, and looking forward to the remaining coming parts of this series as well.
Wonderful. Well, thanks again, Kevin. It's great to be on here and happy to help.
Absolutely. Thanks to you, and thanks to all of you for listening to this episode of the DoctorByCuspid.com podcast. Hey, make sure you catch up on the series that we started with Alan and Ben Erickson with some HR case studies that I think will really help your dental practice stay on the right side of things and make sure you're keeping that team together and happy as well. Until next time, it's Kevin Henry, Editor-in-Chief for Dr. Bicuspid, signing off, and as always, wishing you nothing but success ahead.